Hi, it's Dr. Palmer. I am coming on today to talk a little bit about some of the things I've been seeing in the office. The biggest thing I've seen this week are ear infections. So I know a lot of you out there, hi there, your children have been sick with colds, and some of them have had one cold after the other, and that's usually a pretty good setup for an ear infection. And I've had this question come up a couple times this week, why an ear infection? And so what happens with young, what happens with young children, usually under the age of 3, is that when they get a cold, of course, they're going to get very congested. And for babies and young children, what happens is they have a eustachian tube kind of on the inside of their middle ear. And in infants and children, this eustachian tube points directly to the nose. As they get older, the eustachian tube kind of angles down and makes it less likely to get an ear infection. But what happens is if your baby or child gets an ear infection and is very congested, all of that congestion builds up inside of the eustachian tube. And if it sits there long enough, it can turn into an ear infection. And so usually what happens is babies and children are unable to blow their noses. So that is one thing that actually also helps prevent an ear infection. And so now the baby has all of this mucus or congestion inside the eustachian tube, and that actually can trap bacteria. The bacteria that we have in our nose and mouth actually are typically the ones that will also go on to lead to ear infections. And so what happens over time is the bacteria sit in that congestion, and all it takes is a couple of them that are thriving, and then you end up with more and more bacterial colonies that then can turn into an ear infection. So some of the symptoms that can happen with ear infections include babies will touch or tug their ears, or they might have a fever. A lot of times when babies go to sleep at night, if they have an ear infection that is developing, what'll happen is they'll sleep very restlessly, or they'll wake up howling in the middle of the night, because as they lay down, the pressure from the fluid behind their eardrum starts to build, and that can cause them pain. And so they'll wake up in the middle of the night and sit up, and that actually can usually help alleviate a little bit of the ear pain in the middle of the night. Ear infections are really common until about age 3, and hopefully this has been informative. If you are concerned that your child might have an ear infection, those symptoms might include fever, tugging on the ears, or restless sleep. If your child has any of those symptoms, definitely bring them in to see the pediatrician. This is Dr. Palmer at Pediatrician, and I'm happy to see your children when they're sick and when they're well. We'll see you soon. Bye.